CDC says it wants to give people a break from mask wearing, but only once transmission rates improve. But once this pandemic is over, could we be dealing with another epidemic? Some health experts are concerned the pandemic could more than triple the prevalence of chronic fatigue syndrome and depression. Joining us to discuss this and other health news is Dr. Shikha Jain with UI Health. Good morning to you, Dr. Jain. Good to see you.
Good to see you, Sylvia.
So this is an interesting thing here. Let's start with this issue of chronic fatigue. How is this pandemic related, and what are the concerns with this?
One thing, Sylvia, that a lot of people have said since the beginning of the pandemic as we learned more was, well, COVID-19 doesn't impact many people. It doesn't cause many people to get very sick. It's only a small number of people who end up dying from COVID-19. However, what we've been trying to emphasize over the last several years now is that there is this new chronic fatigue or long COVID that is coming out in people who may not even have severe symptoms from COVID when they're diagnosed. So there is absolutely a concern, not just that if you contract COVID, you may end up very sick or you may end up dying from COVID. The bigger concern is that you may end up not very sick at the time or very sick at the time, and then end up with symptoms that last weeks to months after your initial diagnosis.
But what's scary is they're saying it could triple the number of people who come down with chronic fatigue. And then there was another large study that just came out yesterday, and it found that in the year after getting COVID, people were significantly more likely to be diagnosed with psychiatric disorders that they hadn't had initially. So what are we learning about this, and are the two related, chronic fatigue and the depression?
So what we're seeing is, as you said, we're seeing more people who are having mental health diagnoses after they're diagnosed with COVID. And again, these are people, not just the people who are admitted to the hospital, but also people who have COVID and never require hospitalization. Now, it's likely this is multifactorial. Some of it could be biologic, where we know that COVID can sometimes cause mini strokes or little blood clots in your brain. So there may be a biologic component. There's also a psychological component. So there's a lot of different things that could work together to potentially cause this increase in these mental health disorders in people who've been diagnosed with COVID. It is possible that you could have chronic fatigue and a new diagnosis of a mental health disorder after you're diagnosed with COVID. So again, the concern isn't just the people who are getting very sick at the time they're diagnosed. It's all of these long-term impacts that getting COVID could potentially have on you after you've been recovered from the acute illness and acute viral problem.
And what do you want to say to those people who are watching right now and hearing you talk about this? What can they do?
I've heard a lot of people who say, well, I might as well just get COVID and get it over with because I'm not going to get that sick. What I would tell you is don't be so ready to get COVID. You still need to be taking those precautions. You still need to be staying home if you're sick. You still need to be avoiding others who are sick. Wear a mask in places where you need to be wearing a mask. You need to be washing your hands, because getting COVID doesn't just mean you might get very sick. It also means you may end up with medical problems that will cause you to not be able to walk long distances. It may cause your heart rate to go up. It may cause you to not be able to do your activities of daily living. I know athletes who were very active before they got COVID, had a mild case of COVID, and are still 6 months later not able to walk as far as they could before, and are getting short of breath and fatigued doing just things like taking a shower. So
That's
getting
scary.
COVID is not the way to go. Do not try to get COVID just to get it over with, because you could have these long symptoms and you can get COVID again after you've been diagnosed with it once.
Okay, that's scary to hear. Okay, let's talk about masking. CDC is saying we're going to be ready to ease up on this, but not just yet. Now, your group, Impact, has been very persistent that masking is still necessary. Where do you stand today? The governor is ending our mask mandate here in the state on the 28th. The city says it may not be far behind. So when it comes to masks in general and in schools, where does Impact stand today?
So our numbers have come down very nicely over the last month as we saw that Omicron surge. Now, obviously, we would have liked to see more people vaccinated, and we would have really liked to see kids 5 and under be eligible to get vaccines before these mask mandates were removed. That being said, we can understand why, as the numbers continue to go down and community transmission is low, that it makes sense to remove the requirements for masks in certain spaces, like going into restaurants and stores. However, there is a big difference when we talk about schools. Schools are a place that our kids are going for multiple hours a day, 6 to 8 hours a day, and breathing in the same air as their classmates for long periods of time. We know that we need to keep the schools open for our kids' mental health and for their development and education. In order to do that, until we get more of our kids vaccinated, we need to continue requiring masks in schools. When we look at our vaccine numbers for children, they are much lower than they are for adults. So until we start seeing a lot of kids vaccinated and until we see these numbers much lower, we should keep masks on in schools in order to keep our kids in schools, because at the end of the day, that is the most important thing. And our kids are very resilient. My 3 kids don't mind wearing a mask as long as they get to be in school in person.
Right. Okay. Well, let's hope those numbers continue to plummet and it won't be an issue anymore. Dr. Jane, as always, thanks for joining me this morning. Good to see you.